Hello everyone, I'm Sarah Gibb, Chief Executive of Katherine Low Settlement. Today at the Battersea Summit we have a pivotal opportunity to reshape how the statutory and community voluntary sectors work together. We want to move beyond transactional to create meaningful relational connections built on understanding and shared purpose. Imagine a Battersea where every partnership thrives on genuine collaboration. Together we can make this vision a reality, but it requires your voices and ideas. So we want to know, my first question, do you endorse the need for cultural change in the community and voluntary sector in Battersea?
Hello, I'm Mark Croman. I'm the Place Executive for Merton and Wandsworth at the Integrated Care Board, which is basically the system part of the NHS. I think in terms of culture, across both statutory and voluntary and community organisations, what we need to do is we need to work together. We absolutely need to collaborate, because we know that when we do things on our own, we meet half of the issue or half of the problem. And what we need to do is really invest in the power of community and community organisations to work with us on that prevention agenda, but also in making sure that we're co-producing services that actually meet need and that people will use.
Well, I should firstly start by saying I have been so proud of the journey that the big local and now what is now the Battersea Alliance, in terms of how it's evolved and all its work that it has delivered and achieved right here in Battersea. So obviously the answer is yes.
Hi, my name's Noreen Meehan, Director of Roehampton. I think it's very important that this is led by an alliance of community organisations, so I fully endorse that change.
Hello, I'm Delrita Ajapong from Keys House. I totally support the need for change within the voluntary sector in the Battersea area. I feel that where we've gone in terms of collaboration and showing that true collaboration works is absolutely amazing. But this is just the first step, and we need to keep going and keep moving to make it a truly successful project. And I think that this is the first step. By having the Battersea Summit today, it's absolutely amazing to see so many different organisations, partners, voluntary and statutory partners in one room.
We have only been, or only known really about the Battersea Alliance for the past year. We met David last year and very kindly got invited to the parade at the community festival, which was a fabulous day. In answer to your question, I think it's absolutely right that culture needs to change, and we're behind that.
Hi, I'm Councillor Graham Henderson. I'm the Cabinet Member, in other words, the lead member for adult social care, public health and community safety. And I also chair the Health and Wellbeing Board. And I think you're absolutely correct in asking that question. I think we need a fundamental change in culture across the piece. Certainly when we came into office in 2022, we set about a quite fundamental change, a resetting of our relationship with the voluntary and community sector. And in the next few weeks, we will be launching a procurement for a capacity and infrastructure support mechanism for voluntary and community sector organisations. But what we've also tried to do is fundamentally sort of change the approach of the council to working with the voluntary sector in Wandsworth, because that is vitally important in enabling us to deliver the type of improvements to health and well-being that we are actually working towards and committed to.
My name is Asi Minissi, and I'm part of the facilitation team actually for Big Local, but I also chair the Pan-African Book Foundation, and I'm the founding directress of Asanati, which is a Christian ministry. And I really do strongly believe in that. I mean, that's the way that our organisations have been working from the get-go, because together, what's that? There's that quote from the Planet of the Apes, together strong.
My name is Mark Steed. I'm the Director of Operations for the Wandsworth GP Federation. And my answer to that is yes, definitely supportive of that approach. I think, working at scale across the whole of Wandsworth, which includes the Battersea locality, I think it's important that we recognise the voluntary organisations that currently exist, of which there is a massive amount supporting registered patients in the Wandsworth community. It's just we don't all know where they are and what they do. So to elaborate a little, I'm part of the Urgent and Emergency Care Delivery Board and also the Health and Care Partnership Working Group with Mark Krillman from the ICB, which presents monthly on Live Well, Age Well and Thrive, and presentations from voluntary sector, of which the work they're doing, unrecognised, is actually absolutely amazing.
Yeah, I'm Tessa Strickland, a member of the Big Local, actually right from the start of the Big Local. So I've come with it all the way. I was a local councillor in the ward. So I'm very much in favour of any communities strengthening the opportunity and aspirations of people getting a chance to develop. Yeah, okay.
Hi, my name is Brendan Conway. I am a surveyor and I work with community assets in Wandsworth, and I have supported organisations over the last 10 years like Paradise Co-op, Aylesford Community Land Trust, Just Shelter, and we're currently working on a project in Wandsworth Town on the High Street. Of course, I endorse what capacity means for the voluntary community sector. Ultimately, that is about how do you fund capacity, and ultimately we all realise that funding sits at the heart of this conversation, and what is the funding model based on shared impact measurement frameworks, based on partnership modelling, but how that funding flows, and that comes down to political leadership, skills capacity building within the community and voluntary sector to be able to take that funding, but also an inherent partnership model based on mutuality that allows the funding to be spent in the right ways by the community.
Hello, my name is Dr. Jenny Ellingham and I'm a GP partner at Battersea Fields Practice and part of Battersea Primary Care Network. Yes, of course. I've been a GP in this area now for over 27 years and have longed to see a new community involvement in terms with health to ensure that people's health is seen as more than just blood pressures and cervical screening and cancer, but actually seen as a really holistic overview of their whole lives. So we've always wanted to bring health and community together in a really meaningful way and look forward to doing that.
Hello, I'm Ravi from Wandsworth Care Alliance. We help all organisations in Wandsworth with getting access to funding, volunteers and networking. I definitely do agree and I do endorse sharing kind of more culture within Wandsworth and Battersea. What I really would like to do is to make sure that organisations are connected with one another and really looking after the service user at the end. A specific service user may go through multiple different organisations, may go through multiple different support systems, not just with voluntary sector organisations, but also with statutory bodies. And I think it's really key that we do end up linking up with both all voluntary sector organisations across the borough, also our statutory bodies, to ensure that our services are best supported and they have something that is culturally appropriate to them and is something that can also highlight their intersectionalities.
I do indeed endorse the need for cultural change in Battersea and the wider London community. My name is Anna Pearl-Johnson. I am a researcher with Rocket Science, which is a research and evaluation firm. We've partnered with the Battersea Alliance over the past year to evaluate the good work that they're doing, really evidencing the support and the need for a relational approach in borough.
Hi, I'm Ian Smith. I'm the Chair of Trustees at Providence House. We've been part of the community for the last 60 years. And I believe very firmly that various charities need to work together effectively, and this alliance is a real opportunity to achieve that.
My name's Belinda Drysdale. I work with SW Lions, which is a youth grassroots football team. We do girls 8 to 14 and also young boys under 21s. I do believe that there is a need for the change in the system. I really do. And I feel like the discussions today that we're having will really help move forward with it.
So yes, we find it very important that we are able to collaborate and help with that culture change.
Hi, my name's George Turner and I'm from Carney's community. I absolutely do agree with the change in the culture. I think it's essential that we see the working together and how important that is. We need to not be working in silos. We need to be working alongside local authority, working alongside the integrated care board, and working alongside each other, not competing with each other. We're there to help support each other in our various different aims and objectives.
Hi Sarah, my name's Leah Sieber. I work for Wandsworth Council in Adult Social Care and Public Health. I'm Assistant Director of Commissioning for Public Health and Wellbeing. My answer is yes, absolutely. You know, at the end of the day, we haven't cracked the nut yet. There is always space for change, always space for collaborating to move forwards and ensure that we are supporting our residents as best we can, because we need to be innovative, we need to move forwards, we need to work together to try to achieve those goals, because we have a common goal across both the statutory and community sector to provide the best support for our residents to live as independently as possible and to meet their best potential.
Hi, I'm Abby Carter. I'm the Chief Executive of Share Community. We're an organisation that works with adults with learning disabilities and autism, and we're based in Battersea, amongst other places. I think, endorse the need to change the culture around the voluntary sector in Battersea, but also elsewhere. I think for a long time it's been seen as a kind of a bit on the side rather than fully integrated with all the other organisations that are trying to help improve people's well-being and reduce health inequalities, and we need to be very much part of the solution rather than something on the edge. And also I think the sector needs to probably grow up a little bit in terms of how it acts, making sure that we talk more to each other, we use data better, and we're very more aware of all the different kind of need, but also sometimes the gaps that we need to fill, rather than just assuming that we're all kind of working in our own little silos and don't need to look sideways every now and then. So yeah, very much agree with that.
Hi, I'm Esther. I'm connected to Providence House, the Battersea Alliance and Youth Battersea. And yes, I endorse the need for cultural change within Battersea. I think there's a lot more that the community and the wider services that we need and we work with can do to support people by coming together to change the conversation, to include more people in that conversation, to begin to think more creatively about how we respond to the needs of people in the community and just in the world, and being able to collaborate together to do that well, intergenerationally, cross-culturally, and with fun and a sense of purpose and connectivity that we maybe find difficult to get at times.
Hi, I'm Kate Stock, Councillor for Falconbrook Ward and Cabinet Member for Children at Wandsworth Council. And yes, I definitely endorse the need for us to work together. Nobody in our community has all the answers, so we need to come together, listen to each other and think differently about how we can deliver for communities so that people can live better, more improved, more fulfilled lives into the future.
Very nice speech you just gave there, Anne. And yeah, I absolutely do. First of all, my name is Robert Musgrave, and I'm from Providence House, but I've also been involved with the Alliance from its outset.